one of the most widely stigmatized and marginalized diseases across the globe is leprosy. And as such, it has been affecting people's lives in many aspects. This disease is also being forgotten in the midst of efforts going on to combat the coronavirus and HIV/AIDS. Ladies and gentlemen, this is our Dialogue with the program. I'm Shifa Raulako, and we're going to discuss all these issues. And my guests today are Yohei Sasakawa, WHO Goodwill Ambassador for Leprosy Elimination, and Tasfai Tadessa, Managing Director of Ethiopian National Associations of Persons Affected by Leprosy. Tustelas. My guests, thank you so much. Let's first of all start with the misconception when it comes to leprosy, which has been so widespread, I think, across the globe. So what are the success stories that you have achieved to minimize such misconceptions as part of your efforts going on to eliminate leprosy?
レプロシーという病気は医学的に数多くある病気の中でも
Leprosy is the disease which is quite different from any other disease around the world. Because the reason I say that is because that in case of leprosy, even if the patient is fully cured from the disease itself medically, they are still being put under discrimination, and they were even called as a former leprosy patient. However, in case of TB, for example, once the person is fully cured from TB, they are never being called as a former TB patient. Therefore, this is one of the discrimination that is occurring in the world of leprosy. And it did existed from the Old Testament as well. And in some cases, people have a misconception of the leprosy being described as a punishment from God, or in some cases, because of the ancestors have done something wrong, therefore you have gotten the curse from God. So these are the major misconceptions that has been put under discrimination and stigmatization from such a long time all around the world.
で、これはもうご承知のように大変な間違いでございますから、就職ができない、結婚ができない。
And so there is a major misunderstanding towards leprosy. Not only medical perspective, but there's still a very deep-rooted discrimination and stigmatization that exists in the society. So some cases, the leprosy patient or leprosy affected people is not able to get employed or get married, or in some cases, the children are not able to go to school. And this kind of problem is still ongoing even today.
The different nature of the leprosy is that once the persons or an individuals already diagnosed with the leprosy, it does not stop there. The stigma is followed after the disability. So that disability is manifested in various ways. So, for instance, in Ethiopian case, it can be manifested in marriage, in social interactions. So many people are stigmatized and discriminated due to the leprosy, even though they are already cured from the disease. So this is the result of the misconception about the disease. So the deep-rooted of misunderstanding about the disease still exhibited in all society of the Ethiopians or all of the world.
Okay. Yeah. So to what extent is leprosy prevalent across the globe? Have you made some survey in this regard?
If we are not treated it properly, it is a threat. Now currently at the global level is about more than 250 million of people yearly show that the case of new cases. So it is not even the number is not simple. So even really we are not focusing on the number comparing with other diseases, because as long as we can stop the leprosy, so we have to push, we have to integrate our effort to end up the leprosy. So in Ethiopian cases also, from the global, when you come to Ethiopian cases, there are about yearly there are about 4,000 people are developed the new leprosy cases. So among these, the surprising or the sudden issue is that among this number, almost 14% already came with a disability of grade 2 disability.
Okay.
So grade 2 disability means already the visible disability that cannot be treated, you know. And at the same time, referring with this number, there are about 12% of the patients are children. So this shows us the transmission of the disease. So globally, it is not only a medical case, it is a social case, psychological case, economical case. So it is a very treating issue. Leprosy is a treating issue.
All right. One of the most affected continents when it comes to leprosy, I think, is Africa. You are working to create leprosy-free continent and also world. So talk to me a little bit about the success stories that you achieved so far, and what are some of the challenges still lingering in this regard?
病気としてのハンセン病の制圧は WHO としては1万人に人口1万人に1人以下になれば一応公衆衛生上の問題としては解決したと。
Now, when it comes to the leprosy elimination from a medical perspective, WHO had set the target as below 1 out of 10,000 population. And so long as the country achieves that number, then the country is deemed to be solved from a public health problems in terms of leprosy. However, there are some other implications to this as well. But in case of Ethiopia, Ethiopia has achieved this target quite some time ago. But when it comes to the problem of this number, is that there are some hidden cases that does not appear on statistics, which has become one of the problem. And this disease does not entail any pain amongst the patients. Therefore, by the time the patient is detected as leprosy, there are often cases where the person had already developed disability because the diagnosis was late in time. So the idea for finding the leprosy cases has become quite important, especially lately, in order to have those patients being detected early enough.
Let's also come to Ethiopia. How is Ethiopia affected by this disease annually? To what extent is leprosy prevalent in Ethiopia at this point?
Actually, as it's already mentioned, that Ethiopia already eliminated the global elimination targets. But still, there are a burden area which is highly occupied with new leprosy cases. According to the study of the Ministry of Health and other stakeholders, there are 93 waradas are high burden area. That means there are a large number of new cases arises.
Right.
Even the other is almost about 120 is a medium range. But due to the undermining of the issue, still the middle waradas who were expected that soft now going to be a burden area because there is no continuous treatment, continuous follow-up, and the others. And in addition to the other international, national, and global issues.
Right.
So, of course, the Minister of Health is attempting his effort in the better way than before. And it's based on the indication of this, the new cases. Now the government is, especially the Minister of Health, is awareing and start to contact tracing to addressing the new cases to find from the community and treating early detections. Since if early detected is carried out, there is no disability. So if there is no disability, there is no stigma and discrimination.
Right.
So in such way that the country is doing better. But within this effort, INAPAL plays an important role with the partnership like Sasakawa.
Mhm.
So INAPAL is currently working in 7 regions of the country, and also we have more than 70 grassroots associations. Those are really advocating about the leprosy, carried out the awareness of the leprosy to the wider community, and to carried out self-awareness, to come out from self-stigma.
Right.
So still the association is playing the vital roles. Currently, even it's not only the medical aspect. I mean, this INAPAL is building income generating
Okay, for people affected by
for
leprosy.
people affected by leprosy as a
Okay.
national city. It's here in Addis by support of the Sasakawa Memorial Foundations.
Right.
So from the income generating that building will address the socio-economic problem of the persons affected by leprosy, and for the elderly and severely disabled people affected by leprosy. So INAPAL and the partner with Sasakawa and all the governments as well as the other partners, still INAPAL is working hard to mitigate the burden of the leprosy and the discriminations followed from leprosy.
Sir, let me come to you. Have you made some observations when it comes to leprosy in Ethiopia, and what are some of the encouraging things that you saw? And also, as WHO Goodwill Ambassador for Leprosy Elimination, what specifically are you doing?
ここではその回復者の組織のエナパルという組織
Now, for that, I think the organization formed by leprosy affected people is going to play a key role. And this is called the ENAPAL, as Mr. Tesfaye has mentioned earlier. This is actually one of the largest organization formed by leprosy affected people around the world. And this is helping people who's affected by leprosy to be able to be integrated into the society, because they are sometimes very much worried about whether they're able to be integrated into the society, even if the disease itself is fully cured. They are so fearful of the discrimination may be targeted amongst them when they are put into the society. Therefore, since we have the organization called ENAPAL, these people can now be united and be able to take an active role in order to tap into these discrimination and stigma issues amongst the people affected by leprosy. And I'm hoping that they become the #1 organization and play the key role and become the model case out from this Ethiopia, so that the rest of the world would be able to follow suit of what they have been doing to date. And at the same time, he had also mentioned about the patient, when the patients are having the disability as a child. This is because this disease does not have any pain. And therefore, when the time the patient comes to the hospital, they sometimes have disability already being present. And so I'm hoping that the organization would become much more active in order to actively find new cases, so that the patient can be found early enough and put under medication at a very early time, so that they would not develop any disability and be able to be integrated into the society. So I'm hoping that ENAPAL is going to play a key role here, and I'm counting on them to take that leadership role. And Mr. Shoko.
ぜひテレビの視聴者の皆さんにお願いをしたいと思うのは2点あります。一つは2010年に国連総会
Now, my additional message is especially to the viewers of this program. There are two things that I would like to send out as a message. The first message is that back in 2010, the New York's United Nations General Assembly, where 193 member countries are present, have unanimously voted towards elimination of discrimination and stigmatization amongst the patient of leprosy and the persons affected by leprosy and their family members. Therefore, Ethiopian government had also participated in voting for this, so the discrimination towards these people shall not be done. That's the first message. Second message to the viewers is that I would like all the people to check their family members of their skin conditions. This is what we call as a skin check, meaning that if they check their family members, especially children, and if you see some small white patches like discoloration of skin, whether it's one or several throughout the body, I would like you to check the family member's body so that once you see those small patches appearing, I would like you to take them to the hospital, because there could be a situation where this is the symptom of leprosy. And if you go to the hospital, you would be able to get the medication free of charge. Therefore, if they are detected early at that time, then these people would not develop any disability. So I would like to urge all the viewers to check their family members' skin conditions that way.
Wow, that's a wonderful piece of advice you gave us, sir. Let me come to you, Mr. Tasfa. And as you know, let's go back to the misconception when it comes to leprosy. As you know, there are different kinds of misconceptions when it comes to leprosy. On one side, it comes from the victim's side, arising from fear of stigmatization and other issues in connection with that. So what's the level of the society in this connection, and what are some of the activities that you have been doing, especially when it comes to raising societal awareness in this regard?
Yeah, as I mentioned earlier, that like the stigma and discriminations are raised because due to the misconceptions, deep-rooted misconception.
Right.
That was leprosy is hereditary. People thought that leprosy is hereditary.
Yeah.
It's not curable, and it is very infectious.
Yeah.
But that is not the reality. Leprosy can easily curable. So, you know, in Ethiopia or in all of the world, people were thinking that leprosy is not curable. But now, within 6 months or 12 months, if one person or one individual is exposed to the leprosy cases, it can be, if treated properly, they can be cured. So leprosy is a normal disease. It's not different. There is no difference with like other diseases.
Okay.
So nowadays, because of the advocacy and lobby and awareness raising, now that the community are getting knowledge about the leprosy.
All right.
It is going to be better, but not yet achieved the
target.
The target.
Uh-huh.
But now we have different advocates, those who are standing with INAPAL or with persons affected by leprosy, that leprosy is not hereditary. Leprosy is it's a normal kind of disease that can be treated everywhere, every health facility. So people know this. Even nowadays, the marriage is formed with among the leprosy and the other community.
Okay.
No, because of the changing of the attitude and the awareness, and also even they share some kind of social institution like ECO, EDDER, and they get together and they sip coffees, and so such kind of things were not in the previous, but now it is going to be
Things
better.
are improving now.
Improving
okay,
now.
when it comes to
So
okay, go ahead,
yeah,
please.
yeah. So even the individual who are affected by leprosy,
Yeah.
now they are developing self-esteem. They say now we are, I can work, I can do. So this is a great change, you know. And instead of begging, and instead of lying on the street, now they are engaging in income-generating activity, you know. Before they were taught that if they produce something, communities or the society will not buy, or will the exchange maybe matter.
Right.
But now, you know, they know that people is getting aware, and so now they are engaging in the income-generating activity in various forms. So the awareness raising is getting better. When like it's the media also plays an important role.
Absolutely.
Yeah, and Nepal is celebrating World Leprosy Day with the support of different international and national partners and within the government in all over the country. So people, even though the event is very small, we address a large number of the community. So the awareness raising is getting great and great.
Wow. The other misconception comes from the society, wrongly perceiving that leprosy is a curse from God or leprosy transmits from person to person. I think this issue is still persistent somehow in Ethiopia or in other parts of the world. So how are you dealing with such issues?
これはもう可能な限り多くの人に正しい知識を知っていただく。レプロシーは治る病気である。そして薬はただで手に入る。そして差別はしてはいけないと。
Well, I think that the correct information is essential amongst the society because this disease is completely curable and the medicine is distributed free of charge. Therefore, there is no reason to be discriminated. Therefore, I would like media to support us in disseminating this information because this is the only way to correct the understanding amongst the people in the society, which is quite important. And so my hope is that if the viewers can be able to speak about leprosy in their daily conversation, then that's going to be the success for leprosy as well. Because right now people have the tendency to talk about leprosy in a secret manner. So I don't think this is worthwhile to be treated that way because the disease is now completely curable. And like I said, the medicine is distributed free of charge. So this is going to be the easiest way to be fully cured, and it's one of those kind of the disease that we are talking about. So we just have to do our best to try to disseminate such correct information to the public as much as possible in order to help the situation to be improved. And at the same time, the organization by affected people, ENAPAL, is going to play a very important role as well, because they are the group of people affected by leprosy, meaning that these people have lived a tragic life. And their support is going to become quite important so that their life shall not be repeated amongst the young generation people. So for that, their awareness raising activity is going to become very much important.
Okay, thank you so much for that explanation. Would you like to add something?
Yeah, one of the reasons that is people were thinking that leprosy is a curse.
Right.
But if it is a curse, what about the other diseases? What about like TB, who can kill 1 million or 100,000 or 1,000 people per day?
Right.
It's a fallacy,
It can't be a blessing, right?
Yeah.
Of course.
So this is the difficulty of the issue. So, everybody, we know that our God is not blessing me and curse you. Yeah. This is usually, it is a normal disease. If you are exposed to the TB, you will have a TB. If you are exposed to the other cases, you will be. So this is not really the issue. Yeah. So leprosy is not a curse. So as the community should know this. For example, in the family, one guy, one baby or one child will be got the leprosy. But what's the difference that in that family to make this baby is a cursed? Yeah. So this is really the misunderstanding. So actually, this kind of thought were because the leprosy were really the bacteria is known recently. Before before it's known, so people in mysterious situations, so they don't know what's the case of the leprosy. So by now, leprosy is not a curse; it is a bacteria-borne diseases, mycobacteria. So now it is not a curse; it is due to the bacteria. This what I want tell to the viewers is that leprosy is not a curse and it is not hereditary. If it is hereditary, look, there are a number of peoples are in the world with leprosy. So that this our planet should be covered with a person with leprosy. So this it is not hereditary. You know, if your immunity is very less, maybe if you are exposed to that bacteria,
Yeah.
and if you are not really have resistant immunity, so maybe you will catch.
So
that.
it can happen to anybody.
It can happen to everybody.
Yeah.
It's actually the literature says that it is 5% with those who have less immunity. So, so that means it is very weak. Even after the you're exposed to the bacteria, it can be incubated more than 20 years in your body. That shows that it's very weak.
Okay.
But if you feel that in the way, if you feel that bad smell in the morning, you feel common cold, something.
Yeah, right.
Yeah, you know, within 1 day or within 2 days. But if you take the leprosy cases, it can be incubated from 3 to 20 years. So that means this bacteria is very weak bacteria. So we should not fear it. You know, the only the fear resulted from the attached misconception that it is a curse, it is not, it is hereditary.
It is infectious.
Yeah.
Okay. Thank you
So-
so much. Let me conclude our discussion with this question. Sir, let me come to you. As you know, the coronavirus is rampant across the globe. So is this disease, this global pandemic, trying to affect leprosy?
いい質問いただいてありがとうございます。この約2年半にわたりましてコロナのパンデミックによりまして、患者発見の活動が各国で、
Thank you for the good question. In the two and a half years of the COVID pandemic, during this time, it is true that the patient detection campaign had to be stopped. And like I said, one of the problem of leprosy cases is that patients are reluctant to voluntarily go to the hospital. Or in some cases, people are so embarrassed going to the hospital to be detected. Therefore, one of the situations that we're faced with lately is that people has to go to people's homes in order to find the new cases rather than waiting for the patient to come to the hospitals. So this activity has actually had slowed down as a result from the COVID pandemic. Therefore, in order to offset that kind of a slowdown activity, we have started the webinar called Don't Forget Leprosy, so that we can still remind people to not forget about leprosy even during those slowed down times of COVID pandemic.
私の夢はコロナ回復が終わった後はやはりレプロシーの回復者を含めて
And actually, my dream for the society post-COVID is that the society should be inclusive, meaning that inclusive so that the society can embrace all the people with disabilities or people with leprosy, and the children would have access to school as well. So that kind of an inclusive society is something that I would like to see after the pandemic. And this is something very much important, and for that I would like to travel all different countries around the world again.
Thank you. This is a very important point, and you know, the attention of the government, the attention of the society, all divert to the coronavirus
Right.
and others. So during this time, you know, the emergency of the leprosy is increased in medical aspects, because already as Mr. Yao is mentioned. But the other in the social and economical aspect, because of the ban, people are not really people are not interacted. So they have hand-to-mouth economy during that time if they are not really moving in there and working together with others, because so they faced very economic and social problems. Yeah, they are segregated, they lived alone,
Yeah.
and even they don't have to accommodate themselves in economy. So the impact is not uneasy. So that is the reason that the webinar, in the webinar, the Sasakawa Memorial Foundations is raised the Don't Forget Leprosy to the wider, the global community. So that was where we celebrated World Leprosy Day by the motto of Don't Forget Leprosy. So, you know, if we forget these things by today, it will be hard homework for us by
Right.
tomorrow.
Yes.
So, in general, what I would say that peoples or the government or organization or any kind of institution should not be really focused on the number. It is human right issue. It is a human right issue.
Of course.
So they have to consider in such ways. If they are considering, no, the number of the new leprosy cases are very small comparative to the TB, comparative to HIV, it doesn't meaning, it doesn't give a meaning, you know. It is a human right. It's a human right. So the government and any organization or institutions should consider the issue of leprosy in accordance with human rights.
Thank you, sir. Thank you for that explanation. Maybe before we conclude, is there any message that you want to convey?
ありがとうございます。先ほど来言いましたように、レプロシーは単なる病気でございますし、他の病気のように
Well, thank you for that opportunity. Now, when it comes to leprosy, the final message I would like to convey to the viewers of this program is that leprosy is just a disease, and it's no different from any other diseases that exist. And even if you are infected of leprosy, this does not mean that you would die immediately. And therefore, so long as the patient is detected early enough, then this disease is completely curable, as I have mentioned multiple times. Therefore, I would like all of the viewers' help so that check their children's skin, so that children does not have to develop any disability in their future. And for that, we would have to have the support from everyone who's watching this TV. And I would like all of you to check your family's skin right after seeing this program. And at the same time, leprosy is also a human rights issue, as was just earlier mentioned. And discrimination and stigmatization as a result shall not exist and shall not be aimed towards persons affected by leprosy. And I think that it's on the society's side that has the problem of showing discrimination and stigmatization towards these people. So I would want people to also rectify that mindset so that you would not end up discriminating these people after all. So this is my message to all the viewers of this program.
Thank you very much for that message. Do you have any message?
Yeah, when people saw persons with disabled due to the leprosy, always they are expecting that guy has leprosy cases, but it is already they are cured. But they developed the irreversible disability. Maybe they saw the wound and the deformity and the other things. So that is not leprosy. These people, they are already cured. So without understanding the basic issue, people are really stigmatized or discriminated, these persons with disability due to the leprosy. So I advise the community, if they met a person's with a disability due to the leprosy,
Yeah.
he is not really active disease.
Not infectious.
Not infectious
Okay.
disease. So people should know this, and they should give the respect for the persons with a disability due to the leprosy. And the others, currently, what I want to tell to that and pass my message to the wider community that still we need in Nepal needs a large number of supports.
Okay.
Because the issue of leprosy is not really touched.
Mhm.
Still we started because there is a burden of economic problem, social problems, and psychosocial problems. So all these problems need the integrated effort of the community and the government. So I want to say this one.
All right. Yuhei Sasakawa and Tasfaye Tadessa and the wonderful translator.
Thank you.
All of you, thank you so much for your ideas.
Thank you.
Very much.
Well, dear viewers, with that, we come to the end of today's program. Thank you as well for having been with us. Till I see you next time with another program, it's goodbye from me, Chifarolak. Stay safe and take care.